So a related thing to hallucinogens is dissociatives. And if you think about it, the difference between a hallucinogen actually causing you to see something that's not there and a dissociative distorting your reality to where you're interpreting things in a weird way is a very fine line. It doesn't separate very well. So whether you take acid, then you see a bunny that walks across, the room, or if you take ketamine and you're so like gorped out of your mind that you misinterpret, Frank for that bunny, then it's kind of the same effect. And so dissociatives are a closely related group of compounds. Ketamine's the classic for this. A lot of people are often dismayed that people abuse ketamine as a street drug, saying like, oh, if you just want to fall asleep, what are you doing? Like, why would you do that? Most of the people that are abusing this for its street drug purposes are not actually taking a full dissociative dose. They're finding what's called the K-hole, which is where they're basically a little bit more than your analgesic dose. It's in that range, but not to where you would fully dissociate and just fall asleep. Okay, so that's what a lot of people are actually doing. And there's actually a real global emerging problem with ketamine. It's an old drug that's becoming new again. So much so that in China, it's so popular that China recently tried to criminalize it and put it on the banned drug list across the entire world, despite it also being on the WHO list of essential drugs. So it was nearly a drug that was both forbidden to be traded globally, as well as a drug that was required to be traded globally at the same time. That nearly happened a few months ago.